In the fifth and final section of our lecture, Antenatal Obstetric Complications, now we will talk about some other complications that can occur during pregnancy. Very common is urinary tract infection. Because of the growing uterus, there is pressure on the urinary bladder that causes stasis of the urine or obstruction to the urine outflow that cause urinary tract obstruction. Other condition can be pyelonephritis and then some other abdominal complications. So urinary tract infection, this is the diagram of the urinary tract. This is the urinary bladder. So when the uterus is big, it put pressure on the bladder. They are very close. So pressure on the bladder cause obstruction to the urine outflow. This can lead to increased growth of microorganism and bacteria in the urinary bladder that can cause urinary tract infection. So low back pain, how it presents, there is low back pain and general malaise with flu-like symptoms. Might be tachycardia, fast heart rate, pyrexia, fever is common, dehydration and loin tenderness. And the different bacteria that can cause urinary tract infection include Proteus, Pseudomonas, and Klebsiella. So these are common causative organisms. The common cause is pressure on the urinary bladder that cause obstruction to urinary outflow, leads to stasis of the urine or stagnation of the urine. Because of that, there is growth of microorganism and it can cause urinary tract infection. Fever, UTI is one very common cause of fever with chills. If fever with chills are present, usually three very common conditions is malaria, then we have urinary tract infection and amoebic dysentery. These are three very, very common conditions that can cause fever with chills. Predisposing factors, history of recurrent cystitis, renal tract abnormalities, duplex system, scarred kidneys, ureteric drainage and damage, and stones. Diabetes can also lead to urinary tract infection. These are the kidneys, ureter, bladder, urethra. If there is any obstruction due to stone, if there is any damage, if there is scarring of the kidney, all these can lead to urinary tract infection. Bladder emptying problems because of pressure on the bladder. Next is pyelonephritis. Pyelo is for the pelvis of the kidney. Nephro is for the kidneys. So it's the inflammation of renal pelvis, pyelonephritis. Again, there is fever with chills, as I mentioned, very common urinary tract infection. There is fever with chills. There is dysuria, frequency and urgency, difficulty on micturition, flank pain, and there is tenderness, nausea, and vomiting. So fever with chills along with nausea and vomiting is very, very significant indication of urinary tract infection. Microbiology, usually microorganisms, E. coli, very common, 75 to 95%. Then we have Proteus, Klebsiella, Staphylococcus, and then descending less common, septicemia and infective endocarditis. Management or the treatments or drugs used is ceftriaxone, ciprofloxacin, levofloxacin, and then we have parenteral or IV drugs, again cefepime and meropenem. All these drugs, different antibiotics are used. There is dehydration, high fever, and occasionally shock. Treatment is IV fluids, opioid analgesia for pain, and IV antibiotics. These are all the drugs that can be used for treatment of pyelonephritis. Renal ultrasound scan is used for diagnosis. Renal dimercaptosuccinic acid function scan, creatinine clearance, IVU, and cystoscopy. Cystoscopy for visualization of the urinary bladder, IV urogram in which dye is injected and then picture is taken to find out any abnormality or obstruction. The abdominal pain, causes of abdominal pain during the pregnancy. It can be obstetric conditions which include less than 24 weeks. Usually there is abdominal pain, ligament stretching, miscarriage, ectopic pregnancy, urinary retention, and then labor, pains of the labor in the late pregnancy after 24 weeks, abruptio placenta, uterine rupture, chorioamnionitis. All these are the causes of abdominal pain due to pregnancy. Then pregnancy unrelated conditions also can lead to abdominal pain, like uterine ovarian causes. Uterine causes are usually more than ovarian causes. There is torsion of fibroids, degeneration or torsion, ovarian cyst accidents, urinary tract disorder, renal colic, gastrointestinal disorder, appendicitis, pancreatitis, gastroenteritis. So all these can lead to abdominal pain during pregnancy, but they are not directly related to pregnancy, so they can cause abdominal pain. Then some medical causes, sickle cell disease, diabetic ketoacidosis, intermittent porphyria, pneumonia, pulmonary embolus, and malaria. So all these conditions can cause abdominal pain, should be ruled out and should be treated properly. So that was all about section 5, in which we talked about some other complications which can lead to other conditions that can lead to complications during pregnancy. Thank you for watching sqadia.com.